And Dr. Cole, next subject, skating injuries of the knee. This is interesting. We're going to get on one of your patients who is a professional figure skater with Cirque du Soleil here in Chicago and going through an ACL recovery. You don't see this all that often, do you?
No, I mean, certainly we see lots of injuries in hockey players, things like that, but those are usually collision related. But this is a whole different breed because I don't know if you ever seen a Cirque du Soleil show?
Maybe once a long time ago.
Yeah, they're pretty amazing.
Yeah,
and Chicago gets a show, but they're go to Montreal. There's in Vegas. Every big city will have a tent in a Cirque du Soleil, and they're possibly some of the greatest athletes that I've ever seen. It's also very dangerous, and this is not just skating. This is probably a composite of like acrobatics, gymnastics, and also a tremendous amount of skill. So having an injury in this sport has its own, it's all about returning an athlete safely back to sport. This has its own considerations given the demands of it. Let's
bring on our guest, Madeline Stammen, again, a professional figure skater with Cirque du Soleil, talking about ACL recovery in a professional skater. Madeline, thanks for joining us here on Sports Medicine Weekly to share your story. What is the nature of your injury, and what are some of the things you are currently doing to help recover?
Well, hi. Thanks for having me. It's really nice to be here. So this is my second ACL reconstruction. The first time I did it doing a Bielman spin in 2012.
What is that? You'll have to teach us what that is.
Yes, basically I have my right leg behind me in my hands, and so it looks a bit like a scorpion in cheerleading, and basically I pulled up with both of my hands and popped my own ACL.
Oh, wow.
I think that's a first.
Yeah, absolutely.
So I had a hamstring graft the first time, and the second time around we did a patellar tendon graft. So I am pushing month 13 on my rehab and just doing physical therapy 5 days a week, strength training at the Oak Brook Center with Patrick Pauly and David Heidloff, a lot of functional range conditioning, but honestly, the work is in forcing myself to rest.
Yeah, so just to clarify, Madeline came to me as a patient after having failed her first ACL. And how many years were you good for after your first one?
From 2012 up until last year.
Yeah.
So
it was
working.
For a while. Yeah, working fine.
At what age did it happen, Madeline?
I was 18 or 19.
Okay.
Yeah, and then, so there's actually some really interesting research. This is where the research we do really helps. We've looked at, for example, recently re-tear rates for revision surgery. We say, look, what's the most likely graft to succeed when you have to do it again? And clearly using the patella tendon, a piece of bone from the patella, the strip of patella tendon, and its insertion site on the tibia is the best graft to reduce the chance of a re-tear. So we did basically a traditional ACL reconstruction with her. But the thing that she's found challenging is people say, well, how long does it take to get back? You have to look at the individual sport and what the demand of that sport is to make a statement and a prediction so everyone's expectations are managed. And here you have a really motivated athlete who understands how to train and work out, yet is still requiring the fine-tunedness. What are some of the things you're doing? You mentioned you're at the Oak Brook Center. You've got some great therapists, I know.
Yes.
And as you feel free to give them a shout out and tell me what are the things that have really moved the needle now to get you what you need to get back?
Well, I think just some of the extra recovery I've been doing, like nutrition, making sure I'm getting all of my protein, sleeping at least 8 hours a night. I've even added in cryotherapy and some light therapy and infrared sauna, and just really not overtraining, because I think that's what athletes tend to do, is we think sometimes by doing more we're going to get better faster, and that's not always the case. And I'm really finding I feel better when I allow myself to rest. So that's been a huge learning curve for me.
Again, we're visiting with Madeline Stammen. She is a professional figure skater with Cirque du Soleil, going through an ACL recovery as a professional skater. I'm Steve Cashel with Dr. Brian Cole. Our show is Sports Medicine Weekly at sportsmedicineweekly.com on the website. How is it mentally, Madeline, going through an injury, especially now that it's been over a year?
Yeah, it's tough. I mean, I'm definitely a goal-oriented orientated person, and I'm used to being very busy and working a lot. So I've actually started meditating almost every day, just trying to stay present and not trying to think too far ahead, just because, after this much time, it can drive you a little bit bonkers.
Yeah. What you started doing blood flow restriction as well, correct?
Yes, the blood flow restriction with my strength training, just to try and get my muscle bulk back in my right leg, and that has helped so much. Tell me
what that is. I can tell people what it is, but from your view, what is it?
So we use this machine called a Delphi machine, and it basically restricts your blood flow. They attach it to my upper thigh, and then we'll choose a quad exercise. So basically, it traps the blood in my lower leg, and It hurts so bad. Is
it always painful or not? It's not that bad.
With the Delphi machine, it's bad every time.
Okay. Do you feel like it's helping you make gains? It's a good bad. It's a good bad, right?
It's a good, it's one of those good burns.
Yeah.
And you can see my muscle pumps up right after the exercise, and it relieves my anterior knee pain for the rest of the workout.
That's
so if
crazy.
I start a training session with the BFR, I feel better the rest of the day. It's really strange.
Yeah, no, it stands to reason, because you need quad strength. You need monster quads. You have monster quads, but you need them to be functioning. But the thing is, you also have to have great hamstrings, because if you have a big difference between hamstring and quads, that puts you at risk. So training all of that stuff makes sense. Well, it's so great to have you to share your story, and all of us wish you to great success in getting back.
Yeah, final question, Madeline. Again, Madeline Stammen, what have you learned in the few years working with Cirque du Soleil?
I would say they turned me from an athlete to a performing artist. They, normally we're taught, technique and everything's right or wrong. And once I joined Cirque, I was really given the artistic freedom to take my technique and turn it into an art. So I would say that's the number one thing I've learned working in the circus.
Great stuff. Madeline, thanks so much for sharing your story here with us here on Sports Medicine Weekly.
Well, thanks for having me. It's been a pleasure.
Thank you. Wish you the best of success and recovery. We're back with our staple of the show, Ask the Doctor, after this on 670 The Score.